In dentistry and also in oral health, most people know that most individuals have 32 teeth, plus or minus, right? But today we're going to have 32 questions. This is in our video episode where we talk and ask questions that highlight different dental specialties and also dental disciplines within the profession, so that you all can gain some additional insight as to life as a practicing dentist or a healthcare professional, maybe a resident in training, but also as a dentist here in the U.S. So we're going to ask some questions and you're going to listen. First question, what's your name and where are you from?
My name is Dr. Julia Jackson. I am from Philadelphia, born and raised.
Philly, represent the city of brotherly love and sisterly, what was it, sisterly affection?
That's right.
There we go.
215.
There you go. Or 267.
If
267.
late. Yes.
Yeah, as of late. That's right.
Mm-hmm.
Yes. So what's your specialty in dentistry?
I'm an oral and maxillofacial surgeon, the pinnacle of dentistry.
And how long have you been providing care as an oral surgeon?
I finished my residency in 2011, so I've been providing care for over a decade.
Yeah. And where did you go undergrad? And what was your major in undergrad?
So being born and raised in Philadelphia, I went to high school in Philadelphia. I went to middle school in Philadelphia. I have a younger brother who's from Philadelphia. And my mom and I did all the college tours. We went to different universities and figured out that it would be best for me to be in a university that was small so that it could be a nurturing environment. I ended up picking Wesleyan University, which is in Middletown, Connecticut, a small liberal arts college. Sometimes they're called a little Ivy or a small Ivy League institution. And I was a psychology major, and I think it was one of the best moves to get me into the open mind of education.
And the open mind of people that we serve as well, right? How they make decisions, what they're thinking about, all
absolutely
very helpful in understanding and learning that.
Absolutely. I think an educational institution just kind of gives you the structure and the boundaries of where you feel comfortable, and sometimes opening your boundaries and figuring out, hey, maybe I came in to be a doctor. Maybe I came in to take the pre-med prerequisites, but I'm not going to limit myself. I'm going to take psychology. I'm going to take sculpture. I'm going to take architecture. I'm going to take different courses to open my mind, still being in the confines of an educational environment. College is the best.
Overall, would you say what's been the most rewarding part about being an oral surgeon?
I'm just glad that I got to the finish line. The reward is the degree to be an oral and maxillofacial surgeon. The reward is to be able to treat patients in oral surgery daily. The reward is to be an oral surgeon. That was the award, was to finish what we started and to get to a completion. And now to say oral and maxillofacial surgeon, I'm the only oral and maxillofacial surgeon that's an African-American female in the Commonwealth of Virginia. I'm the only African-American female oral surgeon when I was in the Commonwealth of Pennsylvania. There's not that many of us.
And now, then you mean license or board certified, or what's the
practicing
distinction?
Period.
Practicing.
Yep. There's no other African-American female oral surgeon that's practicing in the Commonwealth of Virginia. Period. Well, and in the Commonwealth of Pennsylvania.
Well, Dr. Jackson and I get ready to make that change.
Exactly.
I'm ready. Make those statistics change. All right. So, ladies, as you are considering your careers in dentistry, as you are embarking on going into dental school, starting dental school, if you're looking for specialties to explore, this may be one for you. And this is the reason why you need to go back and listen to some of the things that we're sharing about the highlights, the lowlights, and things that are rewarding, and what a typical day and what training is like, so you have a better perspective. Let's move now to the fun stuff.
Dr. Darwin,
yep.
I challenge any of you all to become an oral and maxillofacial surgeon and practice in the Commonwealth of Virginia. Come find me. So
Well,
I'm not.
they
so
found you today.
So I cannot continue to say that. I've been saying that since 2007. Yep. I don't want to say that anymore. It's too long.
Well, we have found you. They have found you today, and that's why this episode all about oral maxillofacial surgery is so important. 32 questions with Dr. Action Jackson. Darwin, just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. In one sentence, what is the toughest part about your role and position as a oral maxillofacial surgeon?
Toughest part? Well, we are problem solvers. Sometimes you just have to think a little bit longer about the problem. I think one of your questions here was about how much sleep do you get? I don't sleep a lot.
Well, we haven't got
we
to
didn't
the
get
fun
to
part
that yet.
No. But what's been the toughest part about being an oral surgeon for you? What's been the toughest part about being an oral surgeon?
Dr. Darwin, you got me thinking again. I don't know.
All right, well, we come back to
about it.
Come back to it. I got another part that I want you to think about, which is the most rewarding part about being an oral surgeon. What's been the most rewarding part outside of that case where Miss Jones came and brought you some Dom Perignon? There you go. Now you can get in contact with Dr. Jackson, Dr. Extraction Jackson, Julia Jackson, and get some more information about some of the services in her office, but also some of the education that's out there. And if you have questions, just more about oral surgery and becoming an oral surgeon one day. So, been very good. Now, next good thing that you can do is go to the next video. Go to the next video. There's a whole bunch of a lot more stuff going on over here and over there. Go to the next video. Go.
Thank you.